Acute myeloid leukemia kills approximately 1.2 cancer deaths in the United States. On average, around 25% will live for at least 5 years. Ages over 65 are only likely to live, 12% are only likely to live more than 5 years. In 2014 alone, it's estimated 10,460 people to die of AML. Treatments help slow the process and hope for remission in some cases. It not only affects the patients, but its family. Acute myeloid leukemia is a rapid growth of abnormal white blood cells that accumulate in bone marrow and interfere with the production of normal blood cells. This is caused by replacement of normal bone marrow with leukemic cells. This causes a drop in red blood cells, platelets, and normal white blood cells. Symptoms include fatigue, shortness of breath, easy bruising and bleeding, and risk of infection. It's typically fatal within weeks or months if left untreated, and this is usually caused by blood disorders, chemical exposure, radiation, or genetics. Treatments depend on age, subtype of AML, history of blood disorder, and etc. Age, health, and other factors need to be taken into effect account when considering treatment. Doctors are also trying to determine whether there are people with certain disease possibilities may be more intensive treatment. Treatments can choose advanced or by injection or by handle this differently. Some may be sick where others aren't. People that have normal health before diagnosis have a better chance of having a better day-to-day thing than people that have multiple medical conditions. Depression or anxiety kicks in the patient and the loved ones. There's a fear of loss, a fear of sickness, or how it will affect their body. No one knows what each day will bring. It is known that some patients will take lower dosages of treatment so that they will not become so sick and lose a lot of their hair. This disease takes over with little hope. To lean on, not everyone knows how bad a disease can be. You worry day to day whether the treatments or chemo will help you get into remission. Some people have to deal with the fact that they can't beat the odds and that they can't go into remission. There are thousands of new cases every year, and their survival rate is only expected to be 5 years. Treatments can break people down, and people need to realize that there are other people out there battling life-threatening diseases, and everybody needs to stand together and let them know that they're not alone and not to let it defeat them as a person.